Welcome to Valley Regional Hospital's brand new urgent care facility. I'm your host, Elizabeth D'Orazio, and I'm joined by one of the friendly faces here that you'll get to meet if you need their care. This is Anna Kercewich. She's a medical assistant, and she's going to tell us just what it's like to experience the level of care here at Valley Regional's urgent care facility. Thank you.
Hi.
Well, Anna, one of the things you notice as soon as you come in here is it's a very inviting open space, but a lot of hospitals have a great lobby, and then you get in the room and you feel like a veal, you know?
That is not the case with urgent care.
It's not the case here. Tell us about how you guys made the rooms make us feel at home.
Well, they're very spacious. All of the rooms, with the exception of one, they do have windows with shades, so for patient privacy. We do have a table in the middle of the room, but if somebody, for instance, if it's a family, there's plenty of room inside of them for other people to be standing. And
so really a non-hospital feel, more of a
Correct.
caring, nurturing, home-like setting.
Yes, yeah.
And I think that's one thing that sets urgent care apart is oftentimes when you're not feeling well, like the last thing you want to do is feel like you're in a sick room.
Yeah, that is correct. And you don't have to feel like you're in the corner, stuffed in the corner, trying to stay out of the provider's way or the medical assistant's way.
Or
it's very spacious, and if you need a wheelchair, plenty of room. Plenty of room for the wheelchair. Sometimes we do have even the portable x-ray will come up, and they've got enough room as well to move around in there and take an x-ray of the patient. So.
And that's great. So plenty of room for care, or if we have to bring all the other kids in tow.
Exactly.
That is good. So you're going to help take us through it. We've walked into the doors of this wonderful, I would say non-lobby, because you really feel like you're not walking into a medical establishment. That's nice.
It's very comforting when you walk in.
We're coming in, our kid's got a sore throat or a fever or something. We go up to the registration desk, and what happens next? So
there they'll get registered, which can take 5 to 10 minutes. If it's something that's more severe and they need to be seen pretty quick, then we'll take them right in and have the nurse practitioner go ahead and evaluate them to make sure that the urgent care is the right place for them.
Good.
Then I will take them into the room and get their vital signs, find out what's going on, what brings them into the office today. For example, they could have sore throat, or complaints of an upper respiratory infection, or let's say they were hiking and sprained their ankle. They have some ankle pain going on.
Right. And one thing that's kind of interesting, and I'm glad you mentioned it, is sometimes we're afraid, what if I go to urgent care and I need the emergency room? You're going to help evaluate that right at the onset. So if it's there, it's not like, oh my gosh, am I sitting in the wrong spot?
Exactly. And if we feel that it's something that needs to be seen quick, then we will certainly get the nurse practitioner, and they'll go ahead and make the assessment to determine where they need to be.
In terms of age groups that you see, urgent care, it serves everyone, am I correct?
Yeah, from infants to elderly.
Yeah, that's really a great help for a new mom like me, because I'll tell you, my son only gets bloody noses, high fevers, teething problems, colic, only as soon as the primary care office is closed. So we would call and we talk to the primary care provider, and they probably direct us to an urgent care facility like this, and you'd be able to handle us right away instead of me having to take my screaming baby into the emergency room and wait for hours.
That's correct.
When you see someone in an urgent care basis, what are some of the things you try to help them through and learn about what's going on with them? How do you ask them the right questions and bring out of them, because they're probably nervous?
Yeah, they are a lot of the times, but basically when they come into the room, I'll ask them what brings them in today, and then that's when I'm able to get the full history of what had happened. And then from there, the nurse practitioner actually does a great job when she goes or he goes into the room of really educating them on how to be preventing this type of injury, or whether it's a cold or anything like that, washing their hands. And
that's one of the components of urgent care that's nice, is because it dovetails so nicely with primary care. It's not just, okay, here's your aspirin, go home with your fever.
Exactly.
There is that preventative medicine. There's the education on how can I prevent this from happening next time, or what can I do to better this situation.
Exactly.
Now, you've been with Valley Regional a while.
Just a few months.
Yeah?
Yeah.
Now, what brought you to the area?
I actually am a medical assistant. Before this, I was doing a reception job, and I really wanted to get back onto the hands-on part of working with patients and making them feel better, ultimately.
Well, we want to thank you for joining the staff here at Valley Regional, and it sounds like no matter what we're worrying about, if we've got a screaming kid or a sick grandparent, or we're not feeling well ourselves, you're going to take great care of us here in the urgent care facility.
We certainly will.
And the expanded hours are perfect, because who gets sick during 9 to 5? Not anybody that I know. And we look forward to having you come visit and meet Anna here at the urgent care facility. And remember, from pediatric all the way to grandparents and beyond, this is a wonderful way to get the care you need in a quality setting.